Hello everyone, I'm Dr. Sinead Millwood. I'm a GP at Hawthorne Medical Centre in Manchester. I'm going to talk to you about the effect of air pollution on health, which is something I didn't know until about 2 or 3 years ago. So I first became interested in air pollution when the training practice I was at, I was asked by a local climate group to do a video of my commute whilst holding like a handheld air pollution monitor, and it got a great reception. For some reason it seemed to resonate with people, I think because it's in the local area, but basically I realised how bad the problem of air pollution was, even on green areas like the Fallowfield Loop where I cycle every day. So I learned that air pollution in Manchester contributes to 1,200 deaths per year in Manchester, so that's 24 a week. In the UK, it's roughly equivalent to 36 to 40,000 deaths. Greater Manchester has higher than average admission for childhood asthma. It's actually much higher than average, and I'll talk to you about that later. And both Salford and Manchester are in the top 10 local authorities for emergency admissions and death rates for lung conditions. So there are lots of different components of air pollution: sulfur dioxide, carbon monoxide, a few others, and the ones that affect health the most are particulate matter and nitrogen dioxide. So particulate matter is a mixture of solids and liquids suspended in air, mostly comes from combustion or incomplete combustion, and wood burning stoves tend to be the worst culprits. Nitrogen dioxide is a gas, mostly comes from vehicle fumes, and it's a particularly irritant for conditions like asthma. So, talking about particulate air pollution, you've got the bigger particles, coarse particles. They'll enter the upper respiratory tract, they cause rhinitis, and they irritate people's eyes. You may have noticed yourself if you're standing around a load of fumes. PM2.5, PM1, the smaller particles, they penetrate into the lower respiratory tract. They cause and contribute to bronchitis, asthma, pneumonia, COPD, lung cancer. There are patients in Manchester with lung cancer who wouldn't have it if they lived somewhere else. The ones that really worry me are the ultrafine particles. They cross the barrier from the lungs into the bloodstream. Once they're in the bloodstream, they can reach every part of the body, causing premature birth, miscarriage, stroke, type 2 diabetes, low birth weight, heart disease, dementia, high blood pressure, and there's actually emerging evidence all the time coming out that it's affecting almost every disease process you can think of. The WHO did a really massive study from 1990 to 2021. They looked at people all over the world and they worked out what are the biggest risk factors for non-communicable disease. So what do you guys think are the biggest risk factors for disease in the whole world that are not infectious disease? Huh? Smoking? Poverty? I guess I don't think they put it quite like that, but it affects like a lot of things. But yes. Anything else? Processed food, yeah. So like diet and yeah. Anything else? Hey! So, well done, Ian. So a few years ago, they said that the number one problem, the biggest contributor to the burden of disease in the world was high blood pressure. The most recent report, which has been released by the Lancet, I think last month, they've done a review of this whole study, and they've put it in a different order. It is now particulate matter pollution is the number one cause in the world for like burden of disease, really. Number two is blood pressure, smoking, low birth weight and short gestation, high fasting blood sugar, high BMI. That's the order. And these cause the most disease in the whole world. So obviously this is worldwide. If you look at this is a terrible table, but basically they broke it down for area of the world and put them in the order for that area of the world, including the socio-demographic index. So for high socio-demographic index countries, smoking is number one, then it's fasting blood sugar, high body mass index, and then it goes down. But particulate matter is still in the top 10. So for countries like ours, it's still in the top 10 of risk factors for health. And that's Western Europe, which again, we probably fit into. And particulate matter pollution, yeah, it's number 8. So it's like shocking, really. I didn't realise this, and nobody told me about this before a few years ago. The State of Global Air report was also released recently. I think it was UNICEF and a couple of other people joined together to make this report, and this is about global risk factors for death. So it's not like the other one, burden of disease and disability-adjusted life years. This is for death, and again, air pollution comes out number 2 for adults and children. So children are more susceptible to the effects of air pollution. They are at exhaust height. They breathe faster than adults. They breathe more deeply because they tend to be mouth breathers. And their immune systems aren't as good as ours, so they can't fight off the effects of air pollution as well. Air pollution affects their brain development. It affects their ability to learn. And there's loads of studies linking it to how well we can think and process information. 60% of the pollution children breathe in each day is taken in during the school run. And this is something that is definitely reversible. Like, we don't have to have children exposed to this. We can change that. And it's obviously not the best way to start the day if they want to learn, because it's going to affect their brain development. The effect of air pollution on children's lungs has also been shown to be terrible. It reduces lung volumes, it increases cough and wheeze, it increases the use of reliever medication, it increases asthma exacerbations. This is the hospital admissions for asthma in children in England table. You can see that the average for the whole of England is 122 per 100,000. Tameside is 350. It's like almost 3 times the average. Oldham comes second. You can see Rochdale's in there, and Manchester, I think, is 14th in the table. So it's a big, big problem in our area, and it probably is partly to do with the air pollution that we're exposing everyone to. That's a macrophage in a healthy child's lung. The black dots you can see is carbon, and this is a healthy child. So we're all a product of our environment, whether that is the food that we eat or the air that we breathe. And this is what is going on inside everyone's bodies right now. The carbon that you breathe in is going into our cells. That's a map of Manchester showing you the nitrogen dioxide levels. Nitrogen dioxide, the WHO safe limit is, I think it's 10, and in the UK we've got a legal limit of 40, and we're still breaching that in Manchester. So we're frequently breaching the legal limit, which is not a very good limit in the first place. We should be aiming for 10. If you want to, you can put your postcode or your practice's postcode into addresspollution.org. It's not exactly accurate. It's probably about within a kilometre, but it'll tell you roughly what your PM2.5 level is and the nitrogen dioxide level. And if you're at my practice, Hawthorne, I've done it for you. And it's not great. It's not the worst. It says nitrogen dioxide level is 27 on average. So it's not breaching the legal limit, but it's not what the WHO advises. And we and our patients are being exposed to this day in, day out. Children living in the most deprived areas are A, more likely to develop asthma, B, more likely to have worse asthma and increased hospital admissions, C, more likely to receive worse treatment, and D, more likely to be exposed to air pollution. And that's because a lot of our deprived patients live busy roads. They don't have a choice over where they live. It's often on a busy road, and they're exposed to car fumes and high levels of air pollution. It's also worth noting that most of the patients from these families are not contributing to air pollution. They don't have a car, and they don't have wood-burning stoves. So, it's all a bit depressing. So what can be done? You can reduce your own contribution to air pollution. So walk, cycle, scoot whenever you can. Ask yourself, do I really need a car? If the answer is yes, and for myself and my family the answer is yes, Do I need to use it as much as I do? Could I use public transport instead? Could I switch to an electric vehicle? It's not a choice that every family can make. Electric vehicles aren't cheap, but it does help. If you stop your car, switch your engine off. Don't idle your engine, especially it upsets me when people sit outside the school gates idling their engines, waiting for the pickup. It's just churning out more and more air pollution. And avoid home burning. This is something that particularly upset me because we like a fire in my family. Mum, how many fires would Dad light if he could? We've got about 5 stoves, inside and outside. Yeah. So I had a stove. Obviously, when I got my own house, I got my eco stove put in, and it turns out that even an eco stove is 700 times more polluting than a gas boiler. And when I saw that, I thought I better stop lighting my stove, so I don't light it anymore. I think if you live in a built-up area, it's a painful choice to make if you like fires as much as we do. But it's probably polluting all of your neighbours, and I don't know how many children with asthma live in my street, and I don't know how many people are having strokes and heart attacks because of my fire. So I've had to stop. You can reduce your own exposure to air pollution. There can be more air pollution inside your car than outside. That was a recent study. Use quieter streets and paths to keep away from heavy polluting traffic. There is actually like an air pollution forecast, a bit like a weather forecast. Looks a bit like that. Tells you roughly what the air pollution's like on different days. I'm not sure how useful it is. I guess if I had a child with brittle asthma, I'd probably be looking at that. But it's difficult to make changes like that in your own life. And again, avoid home burning. The person that you are exposing the most air pollution to when you burn at home is yourself. Be political. Support low traffic neighbourhoods and clean air zones. Call on your school to apply for school streets to reduce traffic around your school at drop-off and pick-up times. School streets is something that Andy Burnham has committed to doing in Manchester. Unfortunately, he's steadfast on the not doing the clean air zone. You can write to your councillors and MPs. That would be helpful, especially as a doctor. You have a respected voice. So my question is, how do we communicate this to our patients? I have to confess that I'm not very good at it. I don't speak to all of my patients about it, and I probably should. I sometimes pick out particular patients that I think probably need to know. I was wondering if for 5 minutes in your groups, on your tables, you could just talk about which patients do you think we should be targeting and talking about air pollution with? When and where could we target them? Is it just in the consultation? And what actions could our patients take? What are we suggesting that they do about it? 5 minutes, and then I'd like you to nominate a scribe who can feed it back. Thank you. Everyone who's a scribe in your group, so if you could try this again. I know it didn't work this morning, but maybe it will work now. If it doesn't, I'll write it all on this board. Tell me when you're ready, and I'll click the go button. Is it working? You can skip registering. Just skip it. Skip. And then it will go to the... Yeah. Okay, begin. Is it working? Oh, good. Nobody has responded yet. Oh, well done. Yes, it's working.
Is this voting?
I mean, we're not going to enforce this, but it's generating ideas. Ooh, that's interesting. Cold.
Can you go back to the QR?
It's in the corner there.
It's a bit far away. It's too far away, you see.
You don't all have to do it. You can just nominate one person from your table to do it. You got it? What's the big car? What's the big car? Right, in the car park. Oh, it wasn't a cold. I was thinking, are you going to target all the people who come in with a cold? I mean, great, well done, but COPD. The rich. Was that you? Yeah. Any patients with respiratory? Multiple car households. That's interesting. I mean, we should be doing that, but how do you identify them? I think parents is a good idea. Everyone is obviously the right answer. But yeah, great. The ones with big cars. Parents dropping kids at school. How are we going to get them? What do you think? How do we target parents who are dropping kids at school without alienating them?
We talked about going to schools, like targeting other patients at schools, but then we're talking about your school going and it not.
Parents, practice listening to teachers, the letters that were sent out saying that
The parents were listening to the teachers. Oh, they didn't. Yes, yeah. And I think I've done some work around with some schools, and there's a group of us that meet with Andy Burnham occasionally to try and talk about these issues. And we said that school streets don't work if they have to be enforced by volunteers. They need to be something that's enforced by Manchester, by the local authority. They were thinking about getting the cameras, the ANPR cameras, and I think that is a potential goer, but they're still looking into that. But yeah, getting the message out to people. Maybe we should be doing school outreach, GPs going into schools talking about these issues, parents' evenings, maybe.
By PTAs, it's like without that buy-in,
Yeah, they're just not going to do it unless you get that buy-in. Yeah, PTA is a good idea. Yeah. Yep, COPD and asthma. Everyone. Yeah, asthma. Great. Next question. You don't need, you should just come up straight away on your phones. You shouldn't have to put in the QR code again. When and where could we target them? Waiting room. Good idea. Waiting room. I have some posters for you, which I will send out at the end, which you could put up in your waiting rooms. Asthma reviews, great. So do our nurses know about this? Do we need to do some education in our practices? Mum, do nurses know about this? No. I think, yeah, if we could go back to our own practices and do some education with our whole team, maybe the nurses could introduce it into their COPD and asthma reviews. Yep.
What about secondary care?
What about secondary care?
Yeah.
Oh yeah, well there are some secondary care respiratory physicians who are very passionate about this. Raja might know more about that. Yeah, and I don't know if there's a clinic in Manchester, right, for air pollution affected respiratory conditions. Is it just asthma children?
Yeah, sure, asthma children.
Yeah. Really? Yeah. So car parks. Who said car parks? It's a great idea. What were you thinking? How do we get the message? Yeah. Yeah, that's a great idea. Putting up banners in car parks. I know that some schools have done that with like anti-idling campaigns. Do not idle your car. But perhaps we should do that in our own car parks.
Asda.
Asda. What should we do in Asda?
Well, they have big car parks in Aston.
Yeah.
They attract poorer people.
Yeah, that's interesting. So you're trying to target the people who are affected the most. Yeah. Maybe we.
Maybe you should go to Waitrose car park. Or like, what's the
Booths. Yeah.
Booths car parks would be.
Big HGVs.
We're talking about, people actually are affected the most are the ones that actually are keeping the
Yeah.
Car washes where they take those cars to be washed.
Yeah, that's a good idea. Car washes. Only the rich can afford a car wash. Yes.
Just in terms of this, probably being quite cynical and pessimistic, but it does appear, obviously it's people that are the higher earners that are polluting more. And it does, at least to me, seem that there's less of an idea of community and society and things like that. So how do you get, if you've got an idea of how to get those messages across to the patients that could really kind of affect change? Because patients we're talking about, that from, less socioeconomic categories aren't going to be able to, there's not much they're going to be able to do to affect change. What do we do about,
Vote Labour.
Vote Labour. But yeah, how do we target? I guess that's what you're saying about going to car washes and like Waitrose and Booths is targeting the people who are actually causing the problem. I'm not sure where else could we reach those people.
I think it's something about shift and adapt. The car thing we've talked about has always been an anti-car, pro-cycling thing, and it's shifting that dynamic, isn't it? I don't know how.
I think it's hard to frame it. What you showed at the beginning is actually the effect on health.
Yeah, that's what I
And
mean.
taking it out of the rat level,
Yes.
comfortable,
Yeah.
arena, and making it actually pollution kills.
Yeah, making just putting
That's how you frame it.
the way that because it's such a difficult conversation to have with most people. I've personally had some very difficult experiences, particularly around low traffic neighbourhoods and the way people feel about that. I think that all you can do is put the facts. And I know we live in a post-truth world, but still facts hold some sway. And if they come from a doctor, it tends to hold even more sway. So even though I'm not an air pollution expert, I still try and use my position to get that message across to people.
But it's how you do that message, because you have to acknowledge for some people, particularly low employment, they don't have the flexibility in their work to necessarily cycle their kids in or walk their kids in. They have to drive their kids in and then drive to work in a factory or retail or something.
Yeah.
So you have to really acknowledge that and come up with some solutions for that.
Yeah. So maybe not like being, get rid of your car. I also know the other side of the argument, because a lot of people from this community, this anti-air pollution community, are really hardline on it. They're like, why have you even got a car? You shouldn't have a car. Really quite aggressive about it. And I think it doesn't help, does it? It's better to acknowledge that cars are a part of our world. They make people's lives easier. We don't want to make everyone's life hard, but maybe they need to change the way they use their car. Maybe instead of dropping off at the school gates, they could park 10 minutes away and walk their children that last bit. That's the kind of thing that schools need to work with parents about. Yes.
Unfortunately, I think it's also more complicated than that. So when I got my bigger car, I was amazed how many more miles per gallon and less polluting it was than my older car. And actually, a lot of pollution comes from older cars that would pass current standards, hence London and everything else. Similarly, yes, lots of people don't have wood burning stoves, but they've got open fires.
Well, open fires are worse, yeah.
Exactly. So that, you maybe have got wood burning stove, but that's better than an open fire. People I look at, they do open fires, and I know some of them are a great comfort to them when they're on their own, and that's what they're doing. So it's not as clear as the bigger cars are worse, and it's in Waitrose, unfortunately.
Yeah.
And that's one of the things that's made it difficult to enforce some of the clean air zones, because actually it is quite complicated. What happens to people that have older, more polluting cars? What happens to companies and firms and vans when they depend on them? and then they can't run them, or they're taxed every time.
Well, I know, but they had this problem in London. Lots of people fought back against it because of those issues, because it will make their lives difficult. There might be a financial hit. It's gonna be difficult for people to change, but it's still the right thing to change for their health and for everybody else's health. And the thing that they did in London, I think they did try and give. They had like grants so that taxi companies could switch their cars to a cleaner vehicle without having to incur an enormous amount of like financial hardship. So. And that is what I think they did. They did consider that in Manchester, and I don't really know where it went wrong. But I mean, now we're seeing that what's happened is that somebody has been really strong with their leadership in London and done the hard thing and had those difficult conversations. And the outcome is that there is a huge drop in air pollution, and there will be a massive increase in health, like side effects of that, which we don't have. It's actually worse in Manchester because of it, because all the polluting cars from London have been sold to Manchester, and now we have worse cars.
That's the problem though, you're kind of comparing London to Manchester. There's different economics and political will
there are, yeah.
You can't really, but the point I'm getting at, as you mentioned, it is a nuanced conversation. You have to be really solutions focused. So you have to have the conversations really carefully, you really nuanced. You also have to think about the solutions. And actually people will get out the cars. They will get out the cars if they can afford a bike and maintain it, if they feel safe riding it, etc.
Yeah. Have I got like 2 minutes? No.
Not really.
Not really.
Go on, Sinead.
I do my last. Yeah, I'm not very good at timekeeping, am I? We can't do the last question, but I'll just quickly. Oh, is that working?
Yeah.
It looks different on my screen. So there's some leaflets that I can send out to everybody, which you can show to your practice nurses and all the GPs. And you can work through these leaflets with patients if you want to have these conversations with patients, especially like the patients that we talked about. These are some posters you can put up in your waiting room. Essentially, the top line message for patients is air pollution impacts your health. There are things you can do to reduce it and reduce your own exposure. What will get me out of my car? Like at the moment, it's not convenient sometimes. If you made it inconvenient for me to use my car, if you made it expensive for me to use my car in the town centre, I wouldn't use it. I would change the way that I do things. Cost, public transport is still too expensive. Caring. I think caring is the key, and you can't care about an issue if you don't know about it. We need some kind of public health campaign around it, really. I care about my patients, I care about my neighbours, but I care most about my children. And I know that bringing them up in Manchester means that their lung volumes will be smaller than if I brought them up in the countryside. But is the answer for me to move there? Is the answer for everybody who has a serious health condition that's affected by air pollution to move out of Manchester? I mean, that can't be the solution. We need to come up with better ways of dealing with this. Don't worry about this, but there are 2 videos. One was the one of my commute. There's another one educating you can put up in your waiting rooms, which educates people about what air pollution is, how it affects their health. And if you're going to do one thing, then sign this petition for the incoming Prime Minister, asking them to do something about the issue. Thank you for your attention.